Drugs change the brain. We know that. And this can lead to addiction and other very serious problems. So I'm going to call on my own experience as a person in long-term recovery from addiction. The cynic in me says, prevention is just not possible. What do you think?
Addiction, of course, is a brain disease, but it's more than that. It's a combination of biological, psychological, and social risk factors. But just because you have all those risk factors doesn't mean you are going to develop this disease. Vice versa, you could have zero risk factors and still develop the disease. The prevention science tells us that there are things we can do early on or even the beginning phases of that disease to make the damage and the harm minimal. That's the key, to keep people's emotional pain and suffering to as little as possible.
You and I have talked a little bit about the concept of pre-addiction. What is that?
This is a brand new scientific term we're learning about. This idea that before one develops the full signs and symptoms of addictive disorder, that there are things that they do in their lives, their experiences, their choices, their biology, that sets them up to be at greater risk for addiction. I'll give you an example. One of the things is impulsivity. We know that when men and women, young men and women have high traits of impulsivity, that sets them up for potentially addictive disorders later on. We can measure that by something we call the marshmallow test. And you may have heard this before, where if you give a child a choice, do you want one marshmallow right now? Or do you want two, but you have to wait for it? The child that says, give me that one marshmallow right now, and you're raising your hand,
Me.
instead of let me wait for two, is considered impulsive. That's not a bad thing. That's just a human trait. But where it becomes risky is when you combine things like impulsivity with access to drugs or inability to deal with loss, rejection, or a false view of the world is or isn't. That's when things get to be concerning. Pre-addiction, again, are some early signs of when we see these things. It could be something like changes in sleep patterns. It could be something like having difficulty when you lose and having a lot of tantrums. And these are all signs you wouldn't think to be addiction. But early on, you start to say, hey, those are the beginning signs where if we pay closer attention, we might be able to prevent the full onset of addictive disorder.
I feel like you're describing my childhood.
Well, when you go through the lens of history and recovery, and you go back, think back to when you were 10, 11, 12, and now you look at what were some of those things, thoughts, feelings, and behaviors that set you up, that were early signs that would lead you to using substances again and again and again.
I think this is interesting for parents watching this who may have a 6-year-old who wants that extra piece of cake right now, or who is at a baseball game and cannot keep himself from yelling at other players or yelling at his coach. So these are things that parents should look out for.
I had some friends who they're afraid of their kid developing addiction. And we talk about early experiences as young as kindergarten when they go to like those amusement parks or they go to the carnival games or they go to those arcade games. And there's always that one kid that spends all the tokens within a matter of 2 minutes. And there are other kids that look around and gradually parse it out over the course of 2 hours. But that kid who spends it quickly and it goes back for more. And then when they leave is upset, bitter, frustrated that they couldn't get the giant prize, who isn't just enjoying the party, but is fixated on getting that of which is never enough. That's the kid we worry about. The kid that has a hard time emotionally regulating, the kid, well, maybe the parents haven't set healthy boundaries. Now they're getting $5, $10, $20, $30, $40 worth of tokens. Or the kid that just can never stop. That's an early sign. I think when you play that on all the way to young adulthood, that those are some of the signs we're thinking of as, quote, pre-addiction.
Now I know what parents who are watching this are thinking, oh my gosh, my daughter is that kid. She's extremely impulsive. What do I do? So what can parents do?
Well, the first thing is don't freak out. Don't say, oh my gosh, my daughter is destined to become someone with a person with substance use disorder and send her to a wilderness camp or send her to a boarding school. That's your daughter. And we can use that DNA, that biology, that psychology she's born with and turn it into a much healthier outlook. The first thing I would say to that parent is you have to be a parent first, get to know your daughter And from the time she can hear and understand what you're saying, set a very clear expectation of what that household will tolerate and not tolerate when it comes to substances, not just alcohol, but tobacco, cannabis, electronic media, games, gambling, all those other activities that are potentially addictive.
For the child brain, but then especially the adolescent brain, right?
Absolutely. I had a friend who said to me about 15 years ago, the most dangerous segment of society is teenagers. I said, why? And he said, well, it's because they have adult bodies, but they have underdeveloped brains. And we've known this for hundreds of years, that it takes into about our mid-20s before our brains are fully grown and developed. So right around those ages, between 12 up to 24, they may have trouble with choice, impulsivity, attention. They may not be able to explain clearly why they did that behavior. So I see that a lot of parents are like, how could you be so stupid?
That creates resentment.
Resentment, trauma, tension, anger, frustration. But instead, for parents to take back a step and realize your son or daughter at 14, 15 years old is physically and neurobiologically incapable of these higher order executive functions that we expect. Just because they're an adult body doesn't mean they can do adult activities.
You know, I've been this height, almost 6 feet tall, since I was a teenager. I probably looked like a young woman when I was 14. And you're looking at an adult in appearance, but it's hard sometimes to then remember, oh my gosh, this is a child.
That's right.
You've also talked a lot about early detection. And, you know, it's interesting. We have early detection for other diseases like cancer, mammograms,
Right.
getting a colonoscopy,
COVID.
Right. Exactly. But we don't talk about early detection when it comes to this. What does early detection look like?
I think this is the most confusing question for parents. How do I know when my son or daughter is in trouble? How do I know when my kid is just experimenting or being part of the normal teenage experience versus how do I know when they're going down that rabbit hole toward addiction and rehab and overdose and things like that? So I'll say to parents, look, we don't have brain scans. We don't have blood tests. We do have urine drug screens, but that just tells you whether a substance is in the person's body or not. It doesn't tell you whether you have an addiction or not. So I usually say to parents, if your son or daughter is using substances and you've allowed that within the household rules, if their substance use is improving the quality of their lives and improving the quality of life of your family, then it's probably not an addiction or potentially risky. If, though, they're using substances and it's creating things like arguments, harm, uncertainty, ambivalence, anxiety, fear,
isolation,
doubt, then it's probably not a healthy, normative teenage experience. You're a parent. You make the rules, you follow the law, you establish the guidelines, and you follow through what should be happening in their home. But if you're concerned at all that your son or daughter may have an unhealthy relationship with drugs or substances, you got to seek professional help. Think of it another way. If you're concerned about your son or daughter's height, if you're concerned about them having back pain, if you're concerned about them having any medical problem,
you go to the doctor.
You go to the doctor. And that phrase, early detection, is really crucial. Addiction, again, doesn't show up overnight. It's not like you go to bed Friday and you wake up Saturday morning and suddenly you're in substance use disorder. So if you can get them early on within the first couple of months, compare that if you waited 2, 3, 4 years to get treatment. It's the same thing with cancer. If you get treatment within the first year versus 5 years later, our outcomes are phenomenally way better.
You're going to add years to your life, literally.
So many parents are like, well, how do I diagnose addiction in the home? You don't. That's left up to
You don't do it in the home. You do it with the help of a professional.
You do it with the help of a professional. That's correct.
You also talk about prevention of the progression of the disease.
Right.
Slowing down the pace of progression. What does that look like?
The first thing, of course, is just reducing exposure to toxic substances that change the body. So others might call it harm reduction. I call it just simply minimizing damage. So if someone's drinking, young adult or adult, 12 times a week, And now through treatment or through changes in behavior, they now are only drinking 2 times a week. We've reduced the potential damage. We've reduced kind of the threat moving forward. So one example of limiting progression, of course, is just limiting exposure to addictive substances. The second way of limiting the rapid growth of addiction is accelerating all the other things that we know help. Physical development, sleep hygiene, physical activities, developing things you're good at. I can't say this enough to parents. If your child can be capable and confident at doing 3 things in their lives, that raises their level of self-esteem, that raises their level of just self-awareness, which in turn will reduce the likelihood of addiction.
I just remember being a teenager and then into my 20s having a very low self-esteem for a variety of reasons.
Yeah.
And so for me, it was very easy to turn to those substances that made me feel better.
And isn't it fascinating to think about a teenage years, and here you are, tall, blonde, attractive. Where did those themes of I'm not good enough and my self-esteem isn't there? Was that MTV, popular culture? Was it the environment? All those things. And I imagine what young people are going through. And that's the thing for parents to understand. It is not the same world as it was even 10 years ago.
And I have 2 words for that: social media, right?
That's right.
When we were growing up in the 70s and 80s, you didn't have to worry about Instagram and looking your best. You got your picture taken every once in a while. But now it's the constant pressure that is being put on young people by society, by social media.
I don't think parents quite grasp, well, what am I supposed to do with that? Am I supposed to take their phone, limit their accounts, monitor it to them? It goes back to, again, having conversations, I think, with both sides, both parents and their kids. How are you feeling about your social media? What are you getting out of it? What is the point of all of this? I saw on our news article just last week that a big majority of young people get their news from TikTok and Instagram.
Yes.
So social media is a valuable part of our life experience. But when it turns to something else, when it makes you have FOMO, fear of missing out, or you start to get angry, or you start to wonder, why isn't this person liking my post? And that drives insecurity. Those are the conversations I wish we could have with our children about, it's okay if Johnny or Jane doesn't like your post. Or when you put that out there, what were you trying to accomplish? And again, their frontal lobes aren't developed. I don't know. I just thought it'd be cool. So absolutely, I think that needs to be part of the modern day conversation in families. When we were growing up, it was things like, don't talk to strangers, right? And now it's got to be things like, well, when you post things, what are you trying to do and how is it impacting you?
And now there's so many more variables that parents and teenagers and really all of us have to worry about. We talk so much about boundaries and how parents need to set boundaries if they're going to help their child progress in recovery. But it's often a hard thing to do. Why is it so hard for parents to set and then follow through with boundaries?
I think about my own experience as a parent. My wife and I are both medical professionals. We're very motivated to have a stable home. And even I struggle with boundaries, saying no. Can you have an extra cookie? Can you stay up a little later? Sure. And a lot of it was, I wanted my kid to like me. I wanted my kid also to not be upset. I also didn't want my kid to be frustrated. And there was this weird thing. I just didn't want my kid to have any negative emotions. I think that's shared with a lot of parents. They're afraid because they've had maybe a hard time handling their own negative emotions. They don't want to go through what they went through in childhood, which was hard sometimes.
Yeah.
But I think that sort of issue, creates not enforcing the boundary. Secondly, I think parenting sometimes in this modern age, there's no manual and no one really teaches parents how to set boundaries. And I remember a famous Brady Bunch episode. I don't know if you remember this one, where Greg starts calling his dad by his first name. Do you remember that episode? And I remember as a kid watching that, I said, oh my God, you can't do that. That's a violation of boundaries. That's so disrespectful.
He's Mr. Brady.
He's Mr. Brady, or he's dad.
Yes.
I think it goes back to, what do we even mean by boundaries? We're talking about basic rules and expectations and guidelines for how people should behave in the home.
But you're setting expectations for a teenager whose brain isn't fully developed.
And I think that's why it goes back to explaining to your teenager, these are the house boundaries. These are the guidelines we're setting. We're the adult. You're the child. You may have a voice. We're trying to empower you and we're trying to encourage you to be more independent. Absolutely. But there's still some basic things that cannot be crossed. And I'll give you an example from some of my patients I have. I have an amazing family. I just love them to death. And they're in LA, both in the entertainment business, very hip, very casual, very, sophisticated, chic. And their 16-year-old son would stay out to 2, 3 in the morning. And then he'd call and say, hey, mom, dad, can you come pick me up? And he'd be at a party somewhere 20 miles away. And the mom would get in the car and drive. I said to the mom, how does it make you feel to go pick up your son at 2 in the morning? She said, terrible. I'm afraid, I'm anxious, I'm nervous. I said, why didn't you make a curfew? Why didn't she said, we did. We said midnight. I said, what were the consequences when he violated the expectation or boundaries? Well, we just kind of told him we don't like him doing it. And he kept doing it again and again.
No wonder he kept doing it.
Right. And I asked the young man, I said, your parents said curfew was 12, and yet you keep calling them at 2:00 intoxicated. What's the reason for that? And he's like, well, because and he even said it, they don't enforce the rules. He even said that.
Okay.
He even said that.
Enforcement is important.
Enforcement and follow through with the expectation. Part of it, and when I asked the mom, well, why don't you do it? She's like, well, maybe he's having a good time and I just don't want him to be upset at me. I don't want him to be angry at me. And it took a couple of sessions for that to come out. But deep down internally, that's what she was afraid of.
But does it matter whether the child hates the parents? I mean, you were telling me that you have clients who say, well, how do I work with my child so he doesn't hate me? Does it really matter if your kid hates you?
Well, I think the focus really should be, how do we manage negative feelings? And for whatever reason, in the last 20 years, we've come to try to anesthetize our feelings all the time. Fear, resentment, anger, doubt, uncertainty, all these things, whether you're the parent or you're the child. And again, parents, of course, speaking again as a parent, I don't like it when my child's upset. I don't like it when I'm upset at my child. But we have to recognize this is part of the human experience. And instead of trying to run away from these feelings, we should embrace them and figure out what does it really mean. A lot of those parents who are saying, I just don't want my child to hate me, oftentimes say, that's a little short-sighted. You may have a little disagreement or conflict today, but if we don't manage it now, again, early management, early detection, early prevention, what will this look like 10 or 15 years from now? Again, that child will not have learned how to manage emotion. And you, as an adult, even now, will not learn how to manage distress either on your child's part or when you are emotionally distressed at your child.
Mm. You have said that punitive measures don't work.
That's right.
So punishment, i.e. spanking, taking the phone away, grounding them, you say those things don't work, that there needs to be consequences. Like what?
But when it comes to young people and substances, the usual story I'll hear is, well, my son or daughter started using, I didn't like them, I took their phone away, or I grounded them for 2 weeks, or I took the car keys away. Thinking that's going to change future behavior and that somehow they're going to, quote, learn, oh, that hurt, I won't do it again.
But that doesn't work.
It doesn't last.
Oh.
It may work temporarily, but it doesn't create what we're trying to create, which is understand the reasons why taking substances before the age of 21 are potentially bad for your brain, your body, and your mind. That's what we hope for. And I think back in the 80s when we were in health class, a lot of the addiction prevention stuff was what? Just say no. This is your brain on drugs. Any question? And it was very fear-based. It was very like, hey, you don't want to be one of these kind of crowd. And that was a wrong kind of message.
Yeah.
Now
it didn't
I think
stop me.
Exactly. That's
yeah.
what
I mean, I'll just share a personal story real quick. I remember seeing the egg crack in the pan.
That's the one, right.
And it says, this is your brain on drugs. And I remember at the time being so scared of that and thinking, I'm never going to do drugs. Didn't work.
I think it goes back to parents, really recognizing that following through on consequences are super critical. But why punishment doesn't work, it sends a message that you are bad. You are not worthy. And that's not the message that goes with reversal of addiction. That's the message that creates addiction.
Huh.
So instead we say to parents, you can say, you did a thing I disagreed with. You did an activity that is not part of our household principles. But it's not saying, I don't like you because you did this. And so when you take away their phone, or when you spank them, or you ground them or suspend them from the activity that they love, that's saying you are a bad person and you did a bad thing, and therefore you should be punished.
What are some consequences that would work? Such as like, well, if you're going to drink or smoke pot, I am sending you to a counselor, or you're going to rehab, or something like that.
I think parents are the ones that can create those consequences best with their own family. I can give a laundry list of stuff. It may not work in your family. Some of the things I've used with patients of mine have been, if you continue to use substances, despite the house guidelines or house rules we put into place, first consequence will be you are going to meet with a professional in addiction recovery. Second, you are going to go meet with 2 or 3 other men and women in recovery who are going to come talk to you about it. Third, you're going to write a report on the dangers of cannabis. So even asking your child to write a essay together, that's not punishment per se. It can be perceived that way, but it's really more about empowerment. So the consequences should be things to get people empowered. I don't like the things like, oh, you use drugs, now you got to do 20 hours of community service.
Why doesn't that work?
Punishment doesn't last. Punishment might get you short stretches of, quote, sobriety abstinence, but it may actually unleash a lot of other potential conflicts and hidden issues that the child never had before. One of the flip sides of this is that I often think we don't see enough societal follow through when you break the law. So a child that gets like a DUI or has a car accident, unintentionally hurts someone, there are laws on the book to provide societal punishment. You can agree or disagree whether these are good things or not, but those are the laws. There has to be legal follow through as well. A lot of young people are like, well, what matters? I'm going to get arrested. I'm just going to get bailed out anyway.
No problem. I'll be back driving in a week.
I didn't do wrong, so why should I modify my behavior?
Is your kid spending a night or 2 in jail necessarily a bad thing?
I think the key in that phrase is to say, what can we use to motivate and inspire change? What can we use to motivate, inspire kids to take ownership of their brain, their body, and their mind? For whatever reason, for decades, going to bed early was seen as what? Uncool.
No way. I'm not going to go to bed early. Mean. You're mean.
You're mean. Even among peers. What do you do?
Oh, you went to bed at 10:30?
Yeah, loser.
Right.
So lame. And I wish we could reverse the conversation to say, taking care of your one body, your one brain, your one mind that you're born with.
And your one life.
And your one life, starting at an early age, does seem to matter a lot. And I'm starting to see some things happen, but for parents, that's part of the story, emphasizing we're focusing on growing your body, your brain, your mind as well as we can before you get out of our home. Which is why it goes back to, if one night in jail is what inspires a young person to be motivated, inspired to take care of their body, then great. But the thing is, you can't predict whether that will work or not work. That's why it has to start from each family knowing what would be useful or not useful to inspire their child to do better. Through the years, we've heard things like just say no. That was a classic one. That clearly through science is not shown to reduce drug initiation, drug taking behavior, or rate of addiction or anything like that.
Didn't work.
Prevention-based science, and that's what it is for addiction, is a very, very challenging field. But again, when we listen to the messages that do work instead, it's always going to be around those same lanes. How to take care of your body well, how to take care of your feelings, both positive and negative, how to manage expectations, how to learn to love yourself at an early age. If you knew me as a teenager, you're like, this is not the same guy. You know, I had these big Coke bottle glasses, big braces, very nerdy, still a little nerdy, but even then I had an assurance about who I was. I knew I had a stable home. I knew my future was going to be good. I knew I had a lot of really good friends. You can't replace that, but you can emphasize that early on and say, these are the tools that we know will help reduce addiction later on.
You're lucky you grew up in a stable home. I did too. And there are many people watching who perhaps grew up in a stable home or are providing one. But what about prevention in a vulnerable home where there is a house full of conflict or trauma or financial insecurity, say?
In the last few years has taught us so much since the start of the pandemic about racial inequalities, income inequality, and just the shocking divide that exists in our country and in the world between the haves and have-nots. In a lot of homes I've seen that have so much trauma, single parent homes, not a lot of money, food insecurity,
Maybe one of the
crime
parents
ridden,
is incarcerated, something like
you
that.
name it. There's always community mentors out there. This is probably the biggest need for recovery. It's not just sponsors, but mentors in the community. It could be a priest, it could be a rabbi, it could be a neighbor, it could be a boxing coach, it could be a teacher, it could be just a friend's father. And I think for whatever reason, a lot of parents and a lot of young people have gone away from getting additional mentors that they don't have to pay for. It's easier for me to say, oh, go find mentors and do all this stuff. But I think a lot of folks who are living in those very challenging situations may not recognize that there are these really valuable opportunities out there. One of my favorite patients, she's a single mom and her daughter is 4. And she's working 2 jobs to pay the rent, to pay the lawyers, to pay the therapists and all that. And she spends a lot of time talking to me about what can she do as a single mom with debt and no money and no time for prevention. And then what I realized is that we were having sessions via telehealth. In fact, I've never met her in person. We meet twice a month, 30 minutes. So I'm able to provide for her the treatment, the support, the guidance, the safety, even though her home is a single parent home with a lot of trauma.
You could get these resources online, on Zoom, on the internet, on Teams meetings, whatever it is.
That's right.
And that's a great thing.
What about for folks who do not have a smartphone or folks that don't have ready and steady access to the internet? Or what about folks that don't speak the language or folks that are culturally unsure how to access these things? That's where those partnerships have to come true. So, for instance, in Los Angeles, I work with a number of Asian American mental health where they have the translators. They have the support to get burner phones to families for a year. They have the ability to say, we have a safe space. You can come in and use our internet 7 days a week. So community programs do exist. It's just a matter of people finding them, connecting with them, and taking a chance to work with them.
Is there some kind of golden rule that you tell parents or some nugget that you find is extremely helpful to parents in general?
That's an amazing question. So a key message I have for parents, again, who are concerned about their young person's substance use behavior or concerned about what am I supposed to do with this person's behavior. It starts with very simply, trust the parenting process. You have to learn to parent. And you have to recognize that parenting doesn't end when they get out of diapers. It doesn't end when they go to college. It doesn't end when they get married. It never stops. So we as parents have to up our parenting game. One of the things you and I talked about was how many groups there are for young mothers and fathers, one for newborns, mommy and me classes, and even daddy and me classes. And myself, I remember spending a lot of time talking to parents those first few years. Hey, what do you do? How do you change a diaper? How do you swaddle? Some point when our kids got to be 12, I've stopped talking to my other parents. Like, what are you doing with your son about driving? What are you doing about your son about cigarettes? 12, 13, 14, 15. You need to learn a different set of parenting skills and techniques, and you need to trust your parenting process. I need to come up with a different strategy to engage our son and daughter. Need to find out, well, where can I get this other information? That's why professionals, other parents themselves, other support groups, asking your parenting partner, what are we doing here? Are we on the same page? Are we not? I mean, these are all part of this general nugget of trusting the parenting process.
The issues are so much bigger when they're teens, and yet that's where there are the most questions and there aren't resources. And so it's another reason why we are providing this platform. What if your 17-year-old son came to you and said, Dad and Mom, I have a problem. What would you do when it comes to actually figuring out what treatment would be best for him?
I've thought about this scenario a lot. Every week I get calls from colleagues or other people saying, I have a son or daughter. What's the first thing I do? The first thing people always do is they go to the internet, they open up the browser, and they Google addiction treatment.
And then what do they see?
Bang. And the first few things they'll see are ads that are bought and paid for. Then they'll see a bunch of other stuff. Find Rehab, Rehab Finders, Rehab for You, and they'll start clicking and they'll get taken to various treatment sites. So what I usually tell people when they ask me, well, what's the first thing? Again, before you make any commitments to any treatment, start with treatment professional evaluation. You wouldn't try and fix your car yourself. You wouldn't take your car to some shop 100 miles away because someone said this is the best shop and pay through the roof. You would go to a professional you trust to get a diagnostic evaluation.
Why do parents just go, I got this, I'm good?
For years, addiction treatment and mental health treatment has been not only stigmatized, but it's also been usurped, and it's been created with all these strange myths and popular culture, false information. Treatment is hard. And again, addiction and mental health treatment is not something as simple as go into the hospital or rehab, do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and your kid will be fine. It's much more complex. It's more abstract. I also think a lot of parents still have a lot of shame, a lot of stigma that this could not have happened to my son or daughter. And because it did, I don't want my family and friends to know about it. And let's sweep it under the rug.
What are the biggest misconceptions or misperceptions that parents may have about going to rehab?
It speaks to the biggest misconception of addiction and mental health treatment in general. And that's that you can solve this in 30 days or that you can solve it with just by taking a pill. Addiction and mental health conditions, every single one of those conditions, these are long-term conditions. They ebb and they flow. They require long-term treatment and long-term solutions. By the time most people call me, the addiction is pretty severe. It's what we'll call, 9 out of 11 criteria or 11 out of 11 with lots of damage throughout their lives. So I think that's important for parents to realize at the beginning phases is that this isn't like I'm going to send my kid to camp for 2 weeks or 4 weeks. And then when they're going to come back, they're going to look like they were 8 years ago before they started using substances. I think parents are also going to have to realize they're going to hear 1,000 different opinions about what they should and shouldn't do with their son or daughter from providers themselves, from counselors, from peers in recovery, from other family members, from other friends who they know in recovery. So again, it's not like cancer treatments where they're pretty standardized. Addiction treatment and mental health treatment is completely unique and individualized, which is its strength, but also what makes it really confusing to a lot of folks.
Mm-hmm. One size doesn't fit all. It isn't just going to take 30 days. It isn't just 90 days. It's not even just 6 months.
Right.
What we hope for is a lifetime of recovery, one day at a time.
That's right.
And I'm sure you've heard the expression, I wish you a long and slow recovery.
I have.
Is that a message that parents need to hear that, hey, we hope your child has a long, slow recovery?
I think so. Although I think some parents may be like, gosh, what does that mean? Does that mean I got to pay for treatment forever? Again, trajectories of addiction are widely variable. I've had patients who've gone 2 or 3 months, clearly meeting criteria, and then never again relapsing. I've had other patients that constantly are in and out of using substances or things like that. But the end of it all is always this notion that our brains are constantly changing, even as we're adults. They're constantly healing. They're constantly also being exposed to new stressors and new things that damage it. So instead of viewing this as when should I stop treatment, when should I stop therapy, I again encourage parents and families and young people to say, what am I going to do to continue to get my brain better? What am I going to do to get my brain healed and protected from further damage? What is one of the most powerful tools of treatment? Getting 7 to 9 hours of sleep and getting physical movement 60 minutes a day. People are, what about the medications? What about talk therapy? What about all this other fancy stuff? Yeah, but sleep heals the brain, particularly for young people. Exercise not only heals the brain, but allows the brain to grow. And if you look at what we're doing in America, like 25% of young people are chronically sleep deprived. It's a big number. Even bigger number don't achieve regular physical movement. So people are like, wait a minute, you're recommending sunshine, vitamins, and sleep. I'm like, yeah, because those are our best scientific tools to help heal. So particularly for a young person who's under the age of 18 and they live in the home, and let's say they're staying up super late, the household rules, again, need to go back and say, you need to get those 7 hours of sleep. Dad, you don't know what you're talking about. You're staying up to midnight too. Well, why can't I? Because you are a minor.
And I'm an adult.
And I'm an adult.
The word success is often thrown around in recovery. And I personally am not sure what success looks like. My definition of a successful recovery is different from somebody else's.
Right. One term we use goes back to a definition I heard probably about 15 years ago, where recovery is a voluntarily maintained lifestyle comprised of sobriety, personal health, and citizenship. That's pretty good. I also define it even more simply. I define recovery as a lifestyle where you've maximized your quality of life and you're able to relax and have as much fun as you want. It's about as simple as I can say. Home, health, purpose, and community. Those are the 4 areas of recovery I think are very, very meaningful. When you have a stable home, strong physical and mental health, when you have a sense of purpose and usefulness, and when you have strong personal connections in your life, that's what recovery looks like.
And that's a great life. That's the life I want. That's the life I strive for every day as a person in long-term recovery.
That's right. It's a life we all want.